Hello everyone. Good evening. How are you guys? Am I audible? Shrijan, ASM. How are you? So, कैसी चल रही है preparation? How it's going? Have you guys started or just getting anxious where to start? How to start? Feel free to share. And it's not like a normal lecture or one-to-one teaching. It's just a orientation session to anxious. Okay, Atik. Naveen also anxious. Okay. Shrijan, what about you? You are also anxious? So I guess most of you are anxious. So have anyone started studying for exam? Trying with anxiety. Okay. So anyone started planned study or just randomly completing clueless? Procrastinating to get anxious. Very good. Randomly. That is the answer, studying randomly from, yeah. So this is one of the common mistake that we used to do. We are studying randomly, not paper wise, one topic from paper one, one topic from paper four. Okay. So in the end, we don't remember. So there is no way you will gain anything by reading random topic. Okay. And other thing that I also want to share a short curve. This is y-axis which show the performance. And this is level of stress. This is performance. Okay. As the stress level begin, see, this is the optimum level of performance. When there is no stress and minimal anxiety, the performance is also low. When there is maximum anxiety or as the panic state worsen, the performance is also low. So, for having the optimum performance, you have to have the optimum level of stress. So, थोड़ा anxiety is normal, होनी चाहिए. Little bit of fear is normal, so that you guys started study in a plan way. Okay. And also remember, we all are in the same boat, and I am your captain. Okay. Have any one of you watched Dead Poet Society? It's a classic movie. So whenever you get time, do watch it. It's very good movie. Oh, Captain. Yes. So from now, usually in Psych Reads, the main part of me, my main contribution is this code red, rapid revision. This is what I'm good at. Okay. So for now on, till you pass your exam, until you guys give me party, either you call me Dr. Prachi, which I don't like. Otherwise, you can call me Captain. Okay. I'm the captain of your boat, and we all are here in the same. All are very anxious, and all together will plan to study. Okay. Is it clear? So, should we begin? Yes. So, I just wait, Dr. Manish will join. Dr. Ruhil, I don't understand what you wrote. क्या है मैम? Question, first question. I don't understand what you write here. Okay. So, I guess Dr. Manish came. So, let us first introduce us. I'm Dr. Prachi slash your captain and Dr. Manish, your main teacher. Okay, so first of all, this is a disclaimer since many of you joined. This is not a lecture, this is just a orientation session or just a exam strategy reset. Consider it's like a senior junior talking. Like we used to do in our MBBS day, senior are telling what to write, how to study. Okay. Yes, Rohit, if no one जनरल लेक्चर अगर बाई चांस नहीं लिया है रैपिड इनफ इज enough to pass your exam, not to build whole concept, but it will be enough to pass exam. Even many of student pass the DM entrance. Okay, so nothing to worry.
I will take the questions.
And question will be taken in the later half. First I will ask the question. I am your captain. Okay, so we have four paper 1, paper 2, paper 3, paper 4. Okay, so first of all my question is, what is your goal now? Nothing is missed. We just joined. I introduced myself. Okay. So, iPhone, Srijan, ASM, everyone, what is your goal now for the till your exam? Just one word. Thank you, thank you. Pass.
Very
To
good.
get iPhone, I don't know your name, but pass. Very good, Satish. To top.
Okay, that is also one of the goal.
हाँ मतलब ये रेयर बच्चा है पर सबके लिए देखो अल्टीमेटली
Pass.
हो जाएगा.
Crack. Yes.
Yes, you can crack DM,
Pass.
pass.
So,
So 80% will want to get pass. This is the question my professor asked me to give his before his talk. What is to flip my hair happily? Oh my God.
very good.
बहुत बढ़िया. This is the goal. So वो करने के लिए you have to get pass. ठीक है. Anyway, only thing matters for you now is to get a degree. Okay, and someone who want to crack a DM to crack a DM and then flip his hairs. Okay. And what require for it to get pass? We have two sets of exam. One is theory, another is practical. And you have to get pass in both. Because last time I get DM from students that not from our group, from some other group, that they pass the theory, but they pass not pass able to pass in the practical because they are not able to tell the reference. They are giving answer without any reference. And when examiner asks, where did you study? They are speechless. So that's why our main motto always, whether it is for theory preparation or practical, is that we give reference to you. Even for the first definition, whether it is a dementia, suicide, you have to mention in the bracket for theory, and for practical, you have to tell it. Like I am telling 4 weeks is as per this guideline. Okay, so we are here specialized, no? So we have to tell the reference we are talking. We are not telling randomly as per my experience, as we see in our clinic. This is not the reference. You have to tell the book, a standard one or the guideline. Okay, so what is required? You have four papers, paper 1, 2, 3, 4. And in practical, we have long case, short case, neurology, very important one, and then table viva, grand viva. Okay, so सभी important है, but long question getting all the nostalgic seeing this session, ma'am, sir.
Oh, hello, Elsa.
Hi, Elsa, you also joined.
Okay,
Okay,
thank you.
so Elsa is last year student from Nimhans.
Nahi, from
I guess
she was from AIIMS.
she was from
Yeah,
AIIMS. Okay.
AIIMS Kerala.
Acha, Matangi was from Nimhans.
Yeah.
Sorry.
Mm.
So we have to cover OSCE. We will answer in the last, yes, in the last, okay? So long case, short case, neurology, table viva, grand viva, okay? And for this, your thesis is also very important.
Yes.
Usually, the main question that is asked, in your grand viva is about your thesis, community, forensic. This is the common question asked by usually the professor in the central institute or any professor. Okay, so this is very important table usually. Drugs and neurology case is very, very important in short case. But if you fail to answer majority of question in the long case, then definitely you are in trouble. And for long case, you have to know how to write a history properly, how to examine, and how to present as well as some part of theory, how to manage this patient. Okay, so that's why theory is important both for exam theory examination as well as practical in structured way. Okay, for now, if you have 1 month like in AIIMS, the paper will be in the May. Okay, or 2 months, 3 months, you are not able to cover too many books, so you have to learn structurally and smartly. Okay, so in paper one, we have basic neuroscience, psychology, as well as biostats. One question from biostats is must, 1 to 2 question. So we don't neglect this. This is very important. Then second, adult psychiatry. We always thought this is easy one and we know it, but when it come to exam, there are small topic that we never read. So this is very important thing. Then third one, the bigger one, community, forensic, child, and addiction. I always feared this paper, okay, because it's too many to read. So I always advised, if a majority of you are already have the final strike and these are already uploaded, so I till the code read session begin, I advise you guys to at least cover these. Basic neuroscience, community forensic, and addiction. So it will be easy for you. Okay. And in the four, we have neuropsychiatry. This is my favorite part, and it easy and recent advance. But it's not always the same demarcation. Sometime question from neuropsychiatry come in the first paper. Sometime the basic neuroscience question come in the for paper 4. Addiction come in the paper 2. So sometimes these things will happen. So you don't need to panic. Okay. So always remember, getting pass in exam is different thing and your knowledge is different thing. If you know and you're not able to present or write in structurally in 3 hours, then you will get a less marks and you're not able to get the gold medal or anything if any one of you wanted that. So knowledge is not equal to how you present, recall, and structure in 3 hours. Okay, if you know too many things about one topic and you have 10 question and you spend 1.5 hour in one writing one answer, then you will not get a good marks. Now you barely pass. So this is not about knowledge. This is how you present. Okay. So basically, what examiner expect when you write your answer? Structured answer with a very beautiful writing, heading, subheading. We will teach how to write that. This is session in which we teach you how to write answer even if you don't know any answer. Okay, this is the art, because main goal is to get a pass with the good numbers, and for entrance you have to go through deeply. Write flowchart, clinical relevance. This is the thing examiner want you to write in every question. Okay, this shows that you work in your clinics for last 3 years. You are not bunking your clinics. You are not staying in your hostel. This show that you work hard in last 3 words. So writing the clinical relevance in each question wherever it is possible is very good thing. Then writing in clarity and highlighting the main points. The examiner have to check the 4 paper of each individual in one night after taking your viva. If you write too many theory and which is not structured, not clear, and with bad handwriting, like most of boys I think write in very bad handwriting, except Dr. Manish, he writes very beautifully. I show his notes. So then definitely you will get a bad marks even though you know things. But if you don't present, it is of no use. Writing paragraph, poorly structured, not mentioning the heading, subheading, not highlighting, not using the different shade of pen or color of pen. Okay. So this will happen when you read from too much sources and not consolidated. You read one topic from this book, this PDF, this slide, and you're not consolidated at one place. So before exam, you get confused where to read and you are not able to write properly. Okay, you are doing the random reading that I asked in the initial part of this session, that majority of people started by random reading. Reading one topic from here, paper 1, then reading one topic from paper 4, and in the end we are not able to complete a single paper and not able to revise. Lack of revision cycle. At least 2 to 3 revision is must. What I mean by 2-3 revision, it not the whole syllabus in one revision, at least cover 50%, 50 to 60%, and rest topic of this revision, the remaining one will be taken care in the second revision and revise this one also. So by this, at least one topic you will revise twice. Okay, so this is required. And getting too much anxiety or panic state. The curve I told now, for optimum level of performance, you need optimum level of fear, stress, or anxiety. Okay. So, time needed to prepare. This is the most common DM I get, that I have only 3 months, I have only 4 months, I have 1 month. Is it okay, enough to get clear the exam to pass? So, my answer is yes. Even 1 month is enough if you read smartly. If you're still doing random learning in 1 month, definitely you get in trouble. So 1 month is enough if you read smartly. 2 to 3 months is enough for 2-3 revision.
Two
So
revisions.
okay. So those having exam in August and July and June,
Rest assured.
rest assured, and those having in May also, don't worry. Okay. Now it's time to revise smartly. Any doubt till now? Because 4 months is more than enough. Don't worry.
बहुत टाइम है इसके पास.
Acha, should I tell one story?
हम्म.
So it's my personal story. Manish is my senior. His friends is also my friends. We usually don't call senior junior. We call, there is no this senior juniority in AIIMS. We are colleagues. So basically, I was in your state and it's only 1 month. And I have just do random reading just like you guys. Okay.
We'll come up for that.
Srijan, about Asashi, we cover in the later half. I have only 1 month and I asked my senior, Vasista Pauli, that is it okay and 1 month is enough? So he will like, yes, 1 month is enough. Don't worry. मैंने कहा everyone is study like 3-4 months and I have only 1 month because इससे पहले I have neurology posting. I don't have time. I fall ill. So basically, I again fall ill and I have only 15 days. So if I get panic और I was like नहीं हो पाएगा तो नहीं हो पाता. I gathered my courage. I sleep properly, 6 to 7 hours daily. I dedicated my time structurally and write the list of topic and frequently asked topic that I show you below. And yes, 15 days is enough. I able to do 2 revision and I only study 5 to 6 hours in a day because above that it's not possible. I usually sleep by 12. So don't get discouraged if you have 1 month, 2 month, 3 month, and if you have 4 month. Now start reading. The only thing you have to do, start reading. Okay. Don't worry because if you have not started now, but you have 4 months, this is more than enough.
Last time we had students who were only
Yes.
having three weeks, so they were able to do it. So don't worry. If they can do it with flying colors, you also can do it. If you have 4 months, 3 months, 2 months, more than enough.
So last time code red is initiated by the student request. We are not prepared, and students have only 1 month. So we are doing session like crazy, like 6-7 hour till 4 o'clock in the morning, and people are able to clear even DM, not just the theory exam.
Yes.
Four
For
of four people clear DM only from code red, not the deep study. Okay, so if you study smartly, your approach is good, then 4 months is enough. Okay, Nasreen, this is good. Ab now you have to study. Okay, so your approach is simple. First step you already taken. Now second step is to get a good framework. So what is code red? Core topic first. This is the main thing that I asked you to do. Okay. Then organized answer writing, because you tell your handwriting is problem. So at least write with giving proper spacing so your bad handwriting is also visible. Okay. If you write in clustered and it's not visible with bad handwriting, then it's very poor. So you have to write organized way and beautifully. And what we used to do in the last code red session is every day I send one notes like in lithium, valporate, small notes PDF. I sent in the morning, and in evening I asked everyone just whether you're in the ward or in your room, just go through it once and whether you completed it or not. So with this approach, we are able to cover at least 20 to 25 short topic. Yes, in 1 month.
All the commonly asked topics, the short ones, we used to
Like
send
NMS,
yes,
serotonin syndrome. Okay, just clean Levine syndrome, just small topic, sometime asked as a short note. So daily short topic revision we used to do, and we also do in this. Then exam oriented notes.
This will be provided to you.
This will be provided, both workbook and annotated notes.
Will be given to you.
And Dr. Manish will tell how to approach. If you have your own notes, how to include in this. Okay, if you read something from book, how to include this. So we want before exam you have these 4 notebooks and you read these 4 notebooks, and whatever you read before, just include this in these notes. Okay, and how to do that he will tell you. Then repeated revision. Okay, this is a dialogue from Bollywood movie. It's not, ये जरूरी नहीं है कि आपने कितनी मूवमेंट्स करी है, ये जरूरी है एक मूवमेंट को कितनी बार करा है. So repeated revision is very essential. Okay.
And this gets easy if you watch videos along with the notes. That is why we give recorded videos also, so that whenever you are revising, you can watch the videos, you can get into the flow, you can understand, okay, I missed this topic. I think we should include it now. Otherwise, I'll be missing it on the next go. So you keep on doing it. If you watch 3 times the videos and you have written it down, 80% of your work is done.
Then another one, examine
Yes.
insight-based learning and answer writing. This is very essential for your Viva as well as your theory. And day-wise strategy. Since the 1st of April, we started giving the schedule, even though classes start from the 19 April, but we started giving schedule, so you will start studying. Okay, and how to I provide this, I will tell in detail. So, first important thing, please pay attention now. Okay, the core topic first. This is what I told, I only have 15 days. The first thing I do of that day first of mine, I made go through the last 4-year question paper. This is for paper 4. In paper 4, we have neuropsychiatry, we have recent advances,
CL.
consultation license, as well perinatal thing, and the elderly geriatric component, and neuromodulation. So I go through the last 4-year paper, only our paper. I'm not going through the any other AIIMS or PGI or DU paper. No, I don't have time. So I have to be very smart. So I go last 4-year paper. So I make the list of topic that are frequently asked. Like dementia is very important. Dementia and other amnesty, in which the genetics of Alzheimer, frontotemporal, diagnosis and management of MCL, BPSD, these are frequently asked. So I make a note. Then TBI, another important. Then delirium, another important. So you see, I make stars and I make tick. Okay. So what I meant by triple star? Very, very important, large question, frequently asked. Double star is medium type question, asked but not frequently. And single star, a short note, occasionally asked, newer question. So my priority is I first go with the all three stars in my first read. I try to complete 60 to 70% of these topic and I mark tick. Okay,
That is why
so
it is called as core topics. You don't need to read everything. You have to be smart. You should select which is the important thing which is going to come in the exam. Okay, you cannot gulp in every information now because time is limited. Remember, you have to prepare for exam. You don't have to go from first page to the last page. Okay.
so even in my paper 4, majority of topic is from this, the large question medium. Sometimes the short note come from randomly as per the examiner choice. So, but 80% of your marks come from these 4-star question. So if you miss this, definitely you are in trouble. Okay.
And one more thing, please do focus on your university questions.
Okay.
If you are from, like for example, if you're from a particular university, try to get 4 to 5 year list of all the topics, share with your friends, and sit together, jot it down like Dr. Prachi has done.
Okay, so this you have to then. I am also going through your paper that you shared in CodeRead group,
Hmm.
and we are including topics so that we include last year topic list, increase it at. So this you all have to do for paper 1 to paper 4. This is for yourself. Last year students do that. Then second thing, what we do that after each session, like this is
Paper.
I I wrote in my clinic. After the night, we completed the schizophrenia and other psychotic disorder. This is taken by Dr. Manish,
Day two.
day 2 in adult psychiatry. So, what I do in schizophrenia, I list down the frequently asked question and divide them as per large type, medium type, short note. So I asked everyone to at least after this session you will be able to write this. And this is the frequently asked one. So if after session you are able to write this, then this topic is done.
Hmm.
Okay. So in your next revision, when you read this, you will complete these question. Then you are done with this topic. So this is we do after each session for psychosis, for mood, for neuropsychiatry, for drugs. Okay.
Yes, like if you have invested 5 hours in live session, or if you have seen 5 hours of the lecture, then once you are provided with this, you know that okay, I now know all of these questions because it has already been covered. It has been provided to you in form of notes. Now remember, there can be 5 to 10% of side topics which can come. But for that also, if you just let us know what are those topics which are very odd, like for example, everything what we try to cover is 90% of all the common things. 5 to 10% it might be odd topics. If you just share with us, we'll provide the notes with references. Remember, references will be provided to you and then we can add on to this particular list as an
So last year we also have some this different questions. So students send us, we give them the type note with the references. Okay, but majority we tried, we have given you handwritten one with diagrams, with flow chart. This is our main approach. And majority of them are get these question in their exam.
yes.
Because these are commonly asked and this is must know. Like long term course and outcome of schizophrenia, this is very very important. In this you have to write all the studies, then Indian studies about long term course and outcome of schizophrenia, this is also then assessment and management of catatonia, very very many of students get this question, concept, spectrum and management of delusional disorder, TRS, CRS, this is must know. Okay, so NMS, akathisia, tardive, this many of them are get as a short note also. So this we will provide. This you have to make it for yourself and tick mark.
We'll
So you
provide with
see
this.
how many times a tick mark in the span of 15 days. So I'm not reading from head to toe. I go first read the headings, subheading, one flowchart, one diagram, the main name or some specific name which is unique to this thing, and I am done. If I go through one thing and read in detail from one book, then another book, then I will not able to cover even in 6 months.
Hmm.
Okay, so you have to be very smart. If you know the main thing, the classification, the unique name, the diagram and flow chart, you are good to go for that topic and move to another topic.
Remember, time is with whom you are competing with. Okay, you are not competing with yourself, you are competing with time. Time is really very important. So utilize it very judicially. Yeah.
Now, Dr. Manish.
Okay, so from where to study sources, I'll be very much frank with you that if you have given some time and if you have read during your residency, if you have read Kaplan and Sadok, synopsis, please keep it with you. If you have read from Tasman, please keep it with you. Oxford, good. So if you have these set of books which you have read and have made notes, okay, if you have made notes of all of these, please keep them with you. Now, there are certain topics which are not mentioned in these textbook. Like for example, if you try to read TRS, you won't be finding it in CTP or Kaplan. Then what do you do? Then you need articles. Okay, then you need articles. And remember, not any article, it has to be a standard article. Okay, so even if you have made or have read around 25 to 40% of topics from any of the textbooks, any of the textbooks, you don't have to worry. Just keep the notes if you have made. Even if you have written it in a piece of paper, please keep them. Keep those papers. Keep the papers with you. Now, there are some textbooks which are there specifically for exam. Now, like for example, there is Vyas and Gimere. There is one textbook by Puri, Basant Puri. Good part is they are organized, but bulky. Okay, now there is one more thing that I frequently get questioned. What about tips? Now, tips do consider cover certain topics, but they are unorganized. In some topics, they have given references, but in most, they lack reference. Okay, so this is the problem. But remember that if you have read even a bit of these things, no, it will make sense to you when we'll cover everything. Okay, because all of these are reference sources. And if you have covered even 25 to 40% from these textbook or whatever textbook you have followed, please keep them with you. Keep a notebook or keep something like, uh, you know, like a file or a folder with you. Okay, please keep them with you. A folder in which all the notes are there. If you have made it in loose sheet, okay. If you have written it in a textbook or sorry, in a notebook, keep it there with you. Now, after this, books versus notes. Remember, any day, I'll say that your notes are your own notes are of much value as compared to books when it comes to exam. Because if your handwritten notes are there with you, You are the master of that particular topic. Okay. So even if you have written, like for example, there is NMS, and even if you have written 2 pages about NMS, you know what you have written and from where you have written. You don't need to go to some any other source. No source is required because those 2 pages is sufficient, and you have written it from your own, like in your own writing. You know from where you have written and what you have written. So that part is done. That is the most important thing about your own notes. Now, if you lack your own notes, then there are two things. Either you read and make notes of all the core topics. I think that is what Dr. Prachi has mentioned regarding reading core topics, or you can take notes from seniors. This is what people do. Now there are some problem with this. First of all, if you go to read and make notes, it will take too much time. You don't have time because you are racing against time. And the second thing, notes from seniors, these are not your notes. They might be difficult to understand, unreferenced, and lack updates. Like, for example, if you look into one of the topics which has been mentioned, just like here, just going back, just give me 2 minutes here. If you look into this, management, assessment and management of negative symptoms, assessment and management of cognitive symptoms, there are around 8 to 10 updates which are there in last 2 years that you have to incorporate in your answers. Okay. So remember that if you don't incorporate all of these, it will reflect bad. Now, if you haven't made any notes in code red like previous year, you will get notes for paper 1, paper 2, paper 3, paper 4. And apart from this, we provide one textbook kind of thing in which commonly asked topic has been mentioned. So that, like, suppose if we are not covering a particular topic in live lecture, but it has to be there with you. Remember, it will be there, definitely there with you in this particular textbook. It is a customized textbook that we give. Okay, so all of these paper will be having workbooks plus lectures. If you have time, fill the workbook, watch the lectures. If you don't have time, you have annotated notes plus lectures. But I'll always say in the lectures, in the videos, do it 2 to 3 times. There were students in the last year, they have watched it 5 to 6 times and they were able to pass with flying colors. I'm not uh, exaggerating things because this is what I'll show you all the testimonials. Okay, I had paucity of time, that is why I cannot include all the testimonials. So here it is there. Now, there are certain set of things. Don't use random chat GPT. Don't use it. PPT again, if it is made by you, it is good. Else, don't ever try to use it because that will not give you that kind of understanding. Okay, things to avoid, I'm just writing it down. Random PDFs, random PPT. If it is a PPT made by you or your in your college, it has been presented, you can use it. Else, try to avoid it. Next, things to avoid: random GPT, answers, bulky textbooks, because now you don't have time. Get rid of FOMO. This won't work. Okay, now see how to get rid of FOMO. Okay, so if we have paper one, like we have covered paper one, we have covered paper two, we have covered paper three, we have covered paper four. So 80% we have covered in our lectures, and 5 to 10% is there, which is these are odd questions which can come. And now if you ask me to provide the notes for these odd question, I'll provide it to you. You can add it to these set which you are already reading. Okay, so our particular classes or the lecture all will be referenced. And we'll also tell you while we are making lectures that okay, this particular topic while writing, write it with the reference. So we'll provide you, okay, this is the name of the author that you have to write, or name of the book that you have to write while answering in your answer sheet. Remember, it's 3 hours. You cannot incorporate everything in that 3 hours, so you have to be very much logical in what you are writing. 3 hours is the only time. Some set of students get 10 questions to be answered in 3 hours. Some will have two long question, two medium question, four short notes. So remember, if you don't allocate time, if you don't keep a structured note for a particular topic, you won't be able to complete your paper in 3 hours. Even if you complete, you might lack on some important details. And those details are very important because examiner also has very less time. They have to take their viva and then they have to check. So if they are not being familiar with what you are writing, suppose if you have written a heading and then you have writing in points, very good, because they'll be able to make out, okay, this student has written these things. So this is what we are trying to do. Regarding FOMO, don't worry, we'll have a separate folder for FOMO. Any update or anything that comes, it will be provided to you in the group or through notes. So don't worry about that. There cannot be anything that won't be provided to you. One more thing. Suppose if you have if you have read TROCD and I have read it from an article, suppose. Okay, you have also read it from article. So my article is suppose written by some other author. So you have written it from some other author. You have read it from some textbook. See, the basic crux remains the same. TROCD, the concept will remain the same. The only thing will be the presentation and how you are going to write. So there is nothing called as FOMO, because if you are reading one particular topic, suppose you're reading this topic from Tasman, if you have read it from CTP, if you are reading from any textbooks, or even if you're reading from your own notes or anything, the basic crux or understanding will remain the same. So where is the FOMO? There is no FOMO per se. FOMO occurs only if some set of topics which are important that get left over. That is why we are like in the introduction part, we said right in the beginning that we'll focus firstly on the core topics, then we'll go to the other rest 5 to 10%. Okay. Now I'll hand over to Dr. Prachi regarding the study schedule.
Okay, we are. You said I haven't made any notes till now, and can I study only notes provided in CodeRead? If you are reading CodeRead, going through the lecture and revising in multiple times, then you are good to go. Okay, only reading it once, it's not good. You have to go through the same notes multiple times, then you are good to go for your exam.
At least two
Okay,
times.
and don't get scared if you haven't made your own notes. Many of student not made, and some have this tendency to make notes of everything, and in the end they have so many notes. So don't worry, you have time. You go through these notes. We have made this note from multiple sources because we have all this tendency to make it perfect. Okay, so don't worry. But the thing we want from you to revise it multiple time. I saying this again and again, multiple time. Okay, this is for all of you. And if you have made note from any book or any article, just attach that note with our notes So you have only one notebook for paper 1, one notebook for paper 2, paper 3 and paper 4. So before exam, if you have gap of one day, you're not able to read it from one book, then one note, then our notes. It gets scattered. So in first revision only, attach everything in the one notebook. So if you have gap of one day or 2 day, you're able to go through it without being like, अब कहाँ से ये छूट गया वो छूट गया. Okay,
It's time to declutter and to have
make
a
it organized.
organized. Yes.
Okay, some people have tendency to make everything organized, like Dr. Manish. Some people do organization before exam because they are lazy, just like me. So organization is essential. Some have tendency, some have to do it. So
Now is the time to do it actually.
okay, so we are, and don't worry, we are here to mentor you till you pass your exam, even after. So if you have any anxiety or anything, do share with us. Okay.
Now this is one of the
Now, see, study schedule is very important. So last time, what we used to do, we provide the handwritten schedule
like this.
like this. Like 13, you have to cover this in the morning, this in the night, and do the revision also. Then paper 4. Paper 4 के साथ paper 3 के combination. Then revise it again. Then revise it again. Paper wise we divided. Then we divided topic wise also. In paper 1 covered psychology, in second half cover the genetics neurotransmitter. This is when do multiple revision, not for the first one. I do the new schedule every 15 days, so you will able to do it. Okay, like this. In first day schizophrenia and other psychotic, in the evening cover the live lecture, then mood. So in 3 or 4 days we are able to cover the adult psychiatry revision. Similarly, like this. Now, revision 2. I provide this. Okay, this you see is the month of September.
Last
Okay,
year, yeah.
last year. So we provide multiple schedules and many of them go through it. Many of them just customize this as per their need.
Now see, this is important. If you lack in these generalized schedule, you can ask us to form a customized schedule for yourself. So 4 or 5 people of you, if you want, you can just reach out to us and we can form a schedule for you.
Yeah, many of them are already reach out me and contacted me. So I first tell them to attend today's lecture and after that we can customize schedule. Okay. Now the important thing, how to write answer. Okay, this is very very important because do notice this, as you have bad handwriting. Write very neat and clean in your best handwriting. I am saying again and again. First write the main outline of your answer. Like this is taught by Dr. Manish to me in my exam. What he used to do, that he write following answer. Like the question is define dementia, etiology, assessment and management. So how I begin my answer? I write following answer written under following heading. I first provide the heading and then put it in the box, and then I start with the definition of dementia. So what are the headings in which I included in my answer? Define dementia as per CTP. I write this in the bracket. Etiology, types, assessment. In assessment I write about history, examination, investigation, scales, and then management, pharmacological and non-pharmacological. This is how we made notes. If many of you from final strike, you have seen we had notes in this format. In code red, we also provided in this format but more concise. But these headings are covered. So you have to write like this, then start writing about dementia. So when you start writing, highlight the important points by making a box around it, by making the star. So whenever examiner go through it, he says stars are there. That you make a fancy name around it. If any classification is specific to that topic, you make a circle around it. That examiner pay attention to that. That you know that. It's essential. If you know it, you have to show it. Okay. Use black pen, blue, you can take two shades, and if colorful pens are allowed, you can use it. Avoid red and green. Okay, this is very essential to make it look better. You can use it. Okay, don't write too much theory. If I became examiner, I hate people who will write too much theory because I have to go to sleep. I have to have a dinner after the exam, after a viva. I'm very tired as a examiner. So if I see flowchart, diagram, headings, subheadings, so it's good to go. If you write too much theory, so I don't have time to read it, and it's written in very bad handwriting, I am not able to correctly see what is written here, then definitely I will give you just passing marks or below passing marks. Then use flowchart diagram. This is very, very important. So if you have question on neurotransmitter, just make a exon, write about the synthesis and explain that in synthesis only. I will give the example, I will show the notes how it should be written, but you have to make this. You have to make the receptor type A, type B, yeah, D1, D2. Just whenever it is possible, make the diagram or flowchart. Okay. Then another good thing, if many of you have in 50 marks for 50 page, ऐसा नहीं होता, and you will in 3 hours you don't have that time.
Be
Okay.
realistic. You cannot write 50 pages in 3 hours. So that is the problem.
So fill pages for large question. If we have large question for 24 marks. So we are advised to write at least 8 pages. For medium type, it's 16 marks question and we write 5 to 6 pages. And for short note, 8 marks, we write 4 to 5 pages. And if you have 10 question for 10 marks, at least write 5 pages, 4 to 5 pages for each topic. So you will able to cover whole list of question. You are not cover one question in detail and rest in 2 pages. So you have to cover all pages, all question with good amount of content. This is essential. Okay. So time management is very crucial. You don't feel 3 hours. It's like the paper started and you have only 15 minutes left. Okay, that's why you have to make a strategy before going to your exam hall. Okay. Then, if any disorder or any topic coming on your exam and you have only like 10 minutes, what you have to write? I have this condition with me. I face this in my exam that I have only 10 minutes and the question is, I don't know the question. It's like alcohol may, I don't know, I forget it. So I make the three broad heading. First, definition, or I write about the etiopathogenesis, the common thing I tell if when I taught this topic, I will teach this. Then assessment, the main framework, history, examination, investigation, scale, and management, pharmacological, non-pharmacological. So this remains same for every disorder. So just make the flowcharts. Just cover 2 pages by making flowcharts and writing in detail in the flowchart only. So I covered that question. I get good marks. Okay. So you have to be very strategic while writing your answer. Now see, this is if question come as brain stimulation treatment and you have to write it for 8 marks. So at least you have to write 2 to 3 pages.
4 pages you have to write minimum. Okay.
Okay, if it is as a short note, if in medium you have to write 4 to 5 pages. So first you make this in flowchart format that you have non-invasive as well invasive. This is notes by him. It's very beautifully organized. And if you have less time, even you make this one and spread in 2 pages, then definitely you will get good marks. Is he write beautifully about ECT, RTMS, TDCS, the important point. In invasive about DBS, VNS and epidural.
So it is a
Right.
long note. We are just giving you a glimpse of this chart only.
See, he also highlight the important point by different colors that you should also do. So I am able to see, okay, pacemaker like device, okay, in movement disorder. So this is very essential. Now see, another thing. If a question the most commonly asked, suicide came, what he do? He write the detail definition of suicide from different synopsis, okay, the origin, then different terms around suicide in very beautiful manner. Suicide attempt from synopsis, suicide intent, and see, he wrote the reference. because these are also asked in your practical, and you have to tell the reference, because suicide attempt, okay, intent, these are all important. Now see, what is this? This is side effect of ECT, and you have is add a short note. What you can do, you can make this diagram and start writing. Okay, so this is very structural and visually very pleasing and curiosity provoking. So very organized. So if you write in this manner, making small diagrams, okay, if you're writing about the side effect, if their liver side effect, make a small liver. If you're going about pharmacokinetic, make a liver and a kidney and write a short note here around it. So it will be more visually good.
Like if you
Okay.
write this in paragraph form, no one is going to read. You won't be able to highlight the details. But if you just made this particular diagram only, no, okay, the examiner will see, okay, the dental injury has been mentioned, post-ictal agitation, headache, nausea, vomiting, oh, heart changes have also been mentioned. So it will actually show that this student knows and also know how to make the examiner that, okay, all these points have been mentioned over here. So you are not missing on anything, rather you are just increasing your chance to get better marks.
Okay, so our notes will be made like this only. Now see, early outcome, course and outcome of schizophrenia. So you have to write about the early studies. So in spite of paragraph, you can make this in this tabular form like IPSS endorsement. First, write who sponsored it, that countries involved in this, इंडिया में कौन सी थी, एम क्या था दोनों का, सैम्पल साइज कितना था, एंड इट इज इजी टू रिमेंबर ऑल्सो इन दिस फॉर्मेट. ओके, देन फॉलो अप इसका बेस लाइन पे था 2 years में था 5, बट इसमें एंडोर्समेंट में ओनली एट बेस लाइन एंड 2 years. So it
We'll give it to you also, but just for your example, we're just
what
providing
is
it.
the tools used in both of them. So if you read by comparison, it is easy to get learn it and easy to write also. Okay, now see, if question come as for a neurotransmitter, glutamate is very important. So what should we write? This is notes like basics. First you write about basic and synthesis, then receptors, circuits, then role of glutamate for psychiatric disorder, neurological disorder, and you can also mention some pharmacological agents and their use. If you wrote this much, this is more than enough. You will get a full mark. So see what he read, synthesis, make a diagram about this, how it synthesizes, then receptors, the type of receptors, and these are the diagram of receptor.
If you want, you can make it, else you can leave it, but you need to know.
Okay, so see how he write about the receptor. This, not in theory. Okay, after this, the diagram of circuit, and you can explain it in the diagram only. Then the role of glutamate. Okay, journal function you write about 4 points, then psychiatric disorder, neurological disorder, and you can also write about pharmacological agent. If you cover all the topics around glutamate, this is more than enough. Examiner will know that you know this topic. If you explain only one heading like synthesis in 2 pages and you left other things like clinical relevance, role of glutamate, then you will get less marks.
Like suppose if I have to mark out of 8, if I have to give you some marks to it, suppose I have to give 10 marks, and I'm a very shrewd kind of a teacher, I'll give you 2 marks for this. See, you have written the heading of synthesis. If it is of 4 marks also, I cannot give you less than 2 because you have made this diagram. You have written the steps. You have mentioned the enzymes. Next, you have mentioned the receptors. Again, 2 marks. Okay. Also,
Circuits.
see, you have mentioned the circuit. Even if I give you 2 marks and see the role of glutamate. So anyhow, you are getting some marks which you have already made sure that you will be getting because of heading that you have made. So if you write heading right before this particular question, okay, you
Will be
have
answered.
you'll be writing like answer. This particular topic will be dealt under following headings, right? Synthesis. Number two, receptor. Number three, circuits. Number four, role in psychiatry. If you mention this right in the beginning, No examiner will give you less than 7 or 8 because already you have defined the topic and the headings. So this is a very smart way of presenting rather than writing in paragraphs and filling out pages. Okay. Yes.
Now it's your turn. Any doubt, guys? Now question will be answered. Schizoaffective and schizo-obsessive. This is his favorite topic.
Schizo-obsessive, there is no good source except from the author who has given this term. Okay, schizo-obsessive disorder, the book is by Michael Piotrowski.
So we made notes from that only.
It's a 200 to 300 pages of book, but this is the only relevant source which is there for schizo-obsessive. For schizo-affective, there is no textbook which provide very good theory on schizoaffective. If you have to read about schizoaffective, you have to read about the studies that were carried out in the initial part. Okay, you have to read about Jacob Kassanin. Then you have to read 4 studies that were done and how were the outcome. Okay, then if you ask me, author, you would definitely have to read something for from these two are the authors that you need to read. So instead of going individually, we have compiled it in 5 to 6 pages that obsessive disorder has been.
Okay.
Hmm.
So Bhavya tell she also have note for final strike. If I will be doing multiple revision instead of final strike, is it okay? If Bhavya, you have already read those notes, like you have read notes of psychosis from final strike. Okay. So you already read that. So for the exam also you read only that note.
So
And the
suppose,
topic you have
yes.
not covered from that, you read only from code red.
So suppose if you have final strike notes, don't let it go. Keep it there with you because it
And
is
if
in
you
detailed way.
already read it multiple times, so this will be your main source. If you
Yes.
have not read any topic like schizo-obsessive, schizoaffective, prodrome, or anything, some small topics you have left,
Which
then
is there in final strike, by the way. It is there. If you have not read it, rest assured it will be covered in code red.
okay. But the thing you have read from one source already, read it from there only before your exam.
It's like we are trying to put a sieve from final strike and we'll be giving you only the
Concise. So, Bhavya,
condensed form.
it will be more easier for you because the content remain the same but in a more concise form.
Yes.
Okay, so it will be not much different from final strike. Okay, but it will be organized as per the exam need. In final strike, it is more detailed for deeper understanding. But for exam, many of them have not gone
Yes, you
through it.
can make it only source also. If you want, you can make final strike as your only source.
So
No issues.
definitely.
You can make final strike as your only source. When you are revising, you can watch the videos of Code Red because we are covering whole psychosis in 5 hours, mood disorder in 4 hours. So that will be a fast way to revise things. That is what you can do.
So in last year in Code Red, we covered everything in 68 hours. So
Hmm.
less than 3 days is enough to cover whole videos. So you can do multiple revision. Second thing, if you have your exam in the August, will be able to complete 2 to 3 revision. First, while we are doing the live lectures. Second, when you start reading and seeing video again. And third, by only by notes just before your exam. So no need to worry. Okay.
Okay.
But this is the time when you start preparing. The first thing you should all do is making the priority list of topics, like I did. Okay, go through 4 year paper of your university, of your college. Okay, make the priority list. Triple star, 2 star, 1 star, then send DM to me or send in the group that last year students did, and only then I will be able to help. If you DM me, only then I will be able to help you, na.
So like
Okay, so first make the notes, then ask me, then I will provide a proper schedule for all of you combined and also give the customized one. Okay, but the main thing you have to do is to take help, to approach me. Sometime I reply back, little delay, but I will definitely reply and help you. Okay, sometime I also do a video calling. Last, I guess, 2 day back, I do a video calling with one of the students, and I don't know she's here. So I told her to complete these topics. She is a final strike student, and contact me only after she completed. And she say yes and keep in touch. So there will be accountability. Like she completed only then she contact me. So she will complete the paper 3. Then we will proceed. There is another student, so I also asked him to complete some videos from the final strike or that, and then come to me. So I will help only if you start reading and following the strategy and approach me.
yes.
Whether it is Dr. Manish or me, whenever we get time we will reply back and help you. This
No,
is not just any platform. We love doing this. That's why we do it with all our
efforts.
efforts.
See, final
Okay.
strike, if you have enrolled for final strike, this is like this. A lot of information is there in a organized way. You can definitely keep it as a source. It is all referenced. In Code Red, we just try to target the exam. That is why we have condensed it. Okay. So Bhavya, this is your answer to whatever you have asked regarding what to like. If you're confused between Code Red and Final Strike, if you have Final Strike, no one will be asking you more than that. Okay, that is more than
Okay,
sufficient.
next question.
Next question, please tell me which books I can read till 4 months before exam. One book I'll say is Synopsis. Read Child Psychiatry from Synopsis.
So, Srijan, it varied for everyone. If you have, like, I read some topic from CTP. So, before exam, I read that topic from CTP only and make a concise note or chotu note or sticky note from that only. Night. Okay. So, if you read that topic from CTP, I read lithium, valproate, these topic from CTP only. So, I go for CTP. ओके आई नेवर read synopsis. आई एम द CTP person. So मैंने एग्जाम से पहले वही पढ़ा. If you have never read any book, don't worry. The notes we have made is from all the sources and the important articles.
Ranganath. Ma'am, exam in August. Which paper to start first? Okay.
So it varied individual to individual. I started with the paper 4. That is my favorite. So it's easy to cover, and the currently you have time. So the bigger one, chew the frog first in the morning or catch a frog first in the morning. Start with the paper 3. It has addiction, child, community, forensic. It's a big one and we never pay attention to this. So start with the paper 3, complete it. Paper 2 and paper 4 are easy. Then the Nehru question, I can't remember psychology, Nehru. This is also the thing I faced during my preparation, even one night before my exam. So what I asked him to provide me some sticky notes and help me to remember the key points only.
Okay.
Okay. So
I'll just add on, Dr. Ranganath, don't go for very hard topics. You should have some confidence. Go with easy topic. If you want, you can start with paper number 2, you can start with paper number 3. Read some of the topics which is definitely easy for you. So like suppose if you know TRS in detail, read it so that you have some confidence that okay, if any question comes from TRS, I'll be able to answer. Then you can go on to the harder topics or those topics which you feel that it is difficult for you to cover. So this is the pattern. Usually start with paper number 2 and 3. Paper number 1 is a very volatile one, so you need to cover it at the end.
so I always read paper 1 just before the exam. So I just read it, gulp it, and vomit out in the exam.
Psychology will cover it in 3 hours, and whatever is there will I'll provide diagrams, flowchart, and mnemonics.
And chotu notes.
And
So you can revise it before your exam. You only have to know the key points.
this is there for both your theory, it will be helpful. It will be helpful for your Viva also. Because Psychology is a volatile topic again. So remember this. How can, acha, that is done. Okay. Ma'am, some universities have exam in 4 month, August, how to complete, like,
Already answered.
already this has been answered. Ma'am, can we expect all the videos to be uploaded in final depending on weekend? Yes. By second week of April, we have done the recording. It will be
Processed and uploaded.
processed and uploaded. Second week of April is the final deadline. It will be uploaded. Okay, from our side, we have done it. The other part is doing the refine. They are doing the editing part and on the refinement. Okay. Yes, ma'am.
Vikas.
Sometime question come new, like it's not come previously or treatment and हाँ तो इसमें yes she'll answer this.
So in my exam, another story for 16 marks. Gymnastics psychology come as a 16 marks. Okay. And like Nuru said, I am very afraid of psychology. I don't like it. I'm more like a biology kid. Okay. I love the biology. I love the drugs. So it's very like I don't know how to know. I don't know. I know only two, three words, I guess. So what I write, I present is very beautifully that I know it. I present it like this. So I write it. I answer the following question is answered under following heading because I have to at least fill 4 5 pages for 16 marks, and if I leave it, definitely I'm gonna fail. So I write okay, first the definition, then history, then the approach, the clinical relevance, and the recent update. Even though I don't know all this, I only know two, three words like it's something related to mindfulness or something. I don't know anything. So I just write it around it,
Beating
make
around the bush kind.
beating around the bush. This is tree. I know about tree. I make a thread around the cow and bind it with the tree and the whole story write about the tree, but headings remain around the humanistic psychology, so examiner will know that I know it and I get good marks in this paper. Okay, I was very shocked, but if I leave it, definitely I'm gonna fail. So this is this condition, I have to do it, so I write it beautifully with good presentation. So writing for exam and your knowledge is two different things. If you know how to write, you can able to pass it with minimal knowledge. So this is you have to learn with minimal content how to write each answer. Okay, this is with each lecture I will teach you. Okay, when we are doing neuropsychiatry, how usually the question neuropsychiatric manifestation of SLE, TS, Parkinson, every disorder the question come as this. So how to write it, I will tell in while taking the lecture. So it's a art and you have to learn it for your exam because majority of question are previous year, but 10 to 20% are some newly topics that examiner is currently having fond of. Okay.
Now see, with code red, it will be like will make you so that you can write and pass your exams. If you have read something on top of it, it will be an add-on. But if you just focus on this, it will be something that you can rely upon without having any kind of panic, without having any kind of FOMO, without having any kind of, you know, that you are missing out on something. Nothing will happen. If you have read something above it, it will be a bonus. If you have not read, you can ask us, we'll definitely provide you. This is the problem condition, that if you have too much of thing, it usually overflows and you are not able to complete your paper in 3 hours. You'll always miss on one or two question, and missing one question is a sin. You cannot miss even a single question.
Even when you have only 5 to 10 minutes left, you have to make use of these 5 10 minutes, make through flowchart, but you have to cover that question.
You
Next thing,
you
CPG guidelines
yes,
will be
yes,
covered with
2026 month.
each disorder. Okay, because this is important for theory as well as for your practical. Demand segregation, I
Srijan, if you have enrolled for final strike, this has already been covered. No need. You focus on synopsis.
don't worry, Roshan. If you read it from Code Red in
नहीं
3 hours,
if you
how to go about psychology 4 months before exam?
if you have not read it, okay, one book I can suggest is
Huh.
Wayne Witt.
Wayne Witten, but you have to make your own notes, or if you are enrolled with us, so don't worry, in 3 hours you will be able to go
Wayne
for it.
Witten, but you have to form topics, core topics list. Then you go for this book, Wayne Witten Psychology Themes.
We already shared in the group already. Okay, but you have to be very precise. Okay, if you are very scared of this,
Hmm. Will you help me to curate a daily? That is what we do. If
I
you
think
enroll, we'll definitely do it.
I think we already talked ना, हाँ, अभी हम इस सेशन के बाद यही करेंगे.
Hmm.
वेरी प्रैक्टिकल अप्रोच करना है दोस्त.
हाँ देखो एग्जाम पास करना है एंड maximum effort, minimum time, multiple revision. Okay, that is what we need to do. And if you like whatever we have taught, like in final strike, that will be there with you. If you have enrolled for final strike, no need to uh, re-enroll for code red, because code red is complimentary for anyone who is there in final strike. Okay, and we'll try to cover it in 50 hours. Maximum it can go up to 55 hours, not more than that. Full psychiatry for exams in 55 hours.
So you can able to revise it multiple times,
Hmm.
sometime 1.5x, and with your notes, okay,
Yes.
and with the proper references, so it can also help in your practical. Okay.
Okay. And from 19th, we are starting. 19th, we'll go with paper one. It's Sunday, so we'll have a long day. We'll try to cover everything. Paper two, paper three, paper four, and we have a reserve day. So if some topics are being left, we can cover it on reserve day also.
But as
Our goal will be to complete in this time frame.
but schedule will be started from day April
From
1st.
1st April, you will be getting your schedule.
And as well as I started sharing daily topics in the group, and you have to start reading from 1st April, although classes will start from 19. But
Even, and just sorry, I'm interrupting in between, but if you have any problem, any issue regarding your preparation, anything personal, you can approach either to Dr. Prachi or to me, or you can write it in the group also. We'll definitely reply.
so I don't reply back to some of the DMs because I just want, I already message them. First attend the orientation session, and then we can help you for customizing your schedule and everything. Okay. And these are some
Last year
testimonials.
testimonials.
These students, what they do, like I remember one of my student, Sai Madurai,
Sai
na?
Madurai having
And
also.
she is also mother of two kids, and she also started late. But what she used to do, I tell her to, after reading each topic, just DM me and update me, and she do it.
Yes, yes, recordings will be there. If you cannot attend, no issue. Recordings will be provided to you.
So if you have some accountability, you have to inform someone, just DM me. I see the message. Okay, you have complete this. Now you have to do this. Okay, this is what is the timing. So usually the class will start from
8 to
on
9.
the weekdays. It
Yeah.
will be 8 to 9 p.m. and it will go around, I don't know, जब topics खत्म होंगे, and in the Sundays it will start from 11 a.m.
11 a.m. on Sundays, and we'll try to cover it by 8 p.m. In between, we'll take multiple breaks also. Okay. And remember that last year we had five INI SS toppers from Code Red. Elsa was there in the chat box. She topped her university. There were three gold medalists, from one from Nimans, one from Kerala, and one I am not able to recall. So there were
More.
multiple different people. I am able to recall only a few. That is why I've included only few testimonials. There are multiple. I think there were around 60 testimonials that, and I couldn't post any one of them. I can do only a few. Okay.
So, but you have to put effort from your side.
हाँ.
Okay. You have to start reading now. If you have 4 months, 2 months, 3 months, it doesn't matter. If you have dedication, you started your prep, then we can help you. And definitely The content is structured, referenced, so you have to read it multiple times. We will help you only when you approached us. Okay, we love to help you. And those enrolled us, we start studying, and those not enrolled till now, we have 5 days more for early bird offer. After that, the price will be 18K. Now it is 15, not 15. After the coupon, it will be around 12. So it will reach 18K after that. So recorded session will be provided, both workbook and annotated notes, but those are enrolled. Please keep it with yourself. This is your hard-earned money. Don't share with others. Okay? And in WhatsApp group, not just Dr. Manish and me, other student will also help each other. If someone make concise note of any topic, they will share in the group and other will get help from that. Okay, this is what we make a community of exam going students and we should help each other. Okay, if someone miss the noted notes, then another person send the noted notes.
Now it will be
Okay,
there. You can download it multiple times.
how to manage studies between duties and ward work. So you have to do it. Some people wake up early and study in the morning hours because it's a good time to remember. And some people will, while sitting in the ward, just go through the notes or listen the videos, and after coming take rest of 1 or 2 hours and start studying in the evening. Or you can also go to your library in between your work.
That is why daily we give around 2 to 3 pages of readings to be done. If you are in your ward, if you're in your OPD, you can read 2 to 3 pages daily. And remember, by the time you approach your exams, these daily 2 to 3 pages, you'll be able to cover 40 to 50 topics which will be coming in your exam. So without realizing also, you'll be able to cover it. Even if you're able to read 3 hours daily, more than
More
sufficient.
than enough. Okay.
3 hours daily is more than enough. The only thing is it has to be power packed, concised, having all the core topics first, then the less important topic at the end.
And another thing that I always tell you guys, whatever topic you have read, teach this topic to your juniors or anyone
Hmm.
in a concise format without going through your notes.
Or your batchmates
This
also.
will help you for active recalling that you have read about NMS. You tell 5 points about NMS to a colleague that I have read it. This will help you to know whether you know it or help in the active recall. And you will know this topic from core if you teach this to two different students of your colleagues, your junior, or anyone. So, this is the good thing that we used to do in our posting. Okay, just before the round, RSR made us to teach one topic before the consultant come. So, this is you can also do, and it is very fruitful if you teach each other. Okay, and don't get with the fear FOMO word. I said nothing. Okay.
Anyway,
If you find any person who is spreading negativity, keep a distance till your exam. This is what I tell. Okay. Just start your studying and we are here for you. Any feedback for this session? And definitely we take another session next month until August. We will used to take this session. Okay. We are here to help you till you pass, even after you pass exam. Okay. Last year we are not able to conduct a party, but this year we will conduct passing out party. Okay. Srijan motivated. How to pay? Soumya, you can enroll via website and apply early bird 5,000 or DM me. Love this session. Literally shouting ha ha ha. Ha ha ha.
Rohil, don't worry. There will be many students who will be in panic. That is where
And this is the first stage.
this is stage one. Okay, so when you are done with your reading, no, first time, if you have done one reading also, no, you'll be so much confident that the second reading will be easy, and the third reading, if you do, it will be like, okay, I know this, I don't need to go in detail. So this kind of approach will come. Don't worry.
And we are in this together. And I'm your captain, and you will be able to do it.
And I'll be a strict kind of a person.
There is no ma'am or son. I'm your captain, okay?
I'm a strict kind of person. If you don't do your
That
work,
poet society.
I'll be, I'll be, I'll be.
I captain, yes.
Okay, so you can have the fun part, but I'll be a bit strict because I want things to be done. I want it there on time. So even if I'm speaking one or two words like you have to do it, please be there. So don't worry. You are motivated, I am motivated, I am more motivated. It seems as if we are have both of us have to write our exams again. That is how we felt before conducting this session, that we have to write our exam, we have to pass the exam, and
And after that, we have to go for a party.
party also. Acha, party भी
Last
करेंगे.
time we also went for a party. This is two of us, but this time we conduct a passing out party. But now you have to start studying, and every day I will post one topic. So just go through it while you're in your ward or you're in canteen. Just go through that notes, okay, and help each other in the group with anything. So it's a community. We are in the same boat, okay,
तो
Hasmukh?
सब सब धुरंधर देख रहे हैं?
हाँ
हैं? धुरंधर देख रहा है सब कोई?
हाँ, मूवी देख लेना एग्जाम्स
लास्ट
से
मूवी
पहले,
है, देख लो, उसके बाद पढ़ाई
उसके बाद
करना.
पढ़ाई करना, ओके। चलो, गुड
वॉच
नाइट।
धुरंधर, ओके, एंड देन विल स्टार्ट स्टडिंग.
ओके, गुड नाइट।
ओके, ओके. बाय बाय. बाय गैरी, बाय बाय.